Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hello everyone. It's nice to be on this platform. Uh, it's uh, it's my pleasure to inform everyone about epilepsy. So let's start.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay. Basically, our brain causes tiny electrical signals which controls everything what we feel, think, and do. So a seizure is one thing which causes increase in this electrical activity. So there is a sudden burst of this electrical activity which leads to seizures. And during this episode of a seizure, a person might lose consciousness, he might shake his body, or he may become confused, or even feel sudden fear or panic.
What is epilepsy?
Okay, epilepsy is a medical condition that causes a child to have a recurrent seizure. Okay, so, whenever a child gets two or more seizures more than 24 hours apart, it leads to epilepsy. So, this unprovoked seizure means that there should not be a provoking stimuli like fever or severe infection. So, in the absence of these two stimuli, if the child gets a seizure, it can lead to epilepsy.
What are the different types of seizures and do they affect people differently?
Yes. So there are two different types of seizures. They depend on where the unusual activity starts in the brain. So we classify them as either focal onset seizure or generalized onset seizure. Generalized seizure is the seizure which involves the entire brain, and focal seizure is the seizures that starts from one specific area of the brain.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Not always. For almost half of the children of epilepsy, we do not get a specific cause, and almost the next half, we get common causes like head injuries, brain infection, and sometimes tumors as well. But for the first 50% of the cases where we do not get causes, with the advent of new genetic tests, we are able to find many different genes which are the basis for epilepsy. So yes, definitely. In the last decade, since the genetic tests have been started, we are able to find many such causes that helps us to give to prognosticate and to help parents in giving genetic counseling.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Okay, symptoms can vary a lot, but it depends on the type of seizure the child has. So, if a child is having a generalized type of seizure, he may have symptoms like a staring look with behavioral arrest. He might have uprolling of eyes with jerking of both upper limbs or lower limbs, or sometimes he might become unconscious. So, that is about generalized seizures. And about focal seizure, he might have jerking of one side of the body, that either it involves the left upper limb or lower limb, or the either right upper limb or lower limb, or he might have deviation of eyes to one side or twitching of mouth to one side. So that is about focal seizure. In generalized seizure, child is usually unconscious, whereas in focal seizure, child can be unconscious or he could be having retained consciousness. So this is the main differentiating point in between two types of seizures. So consciousness is the one thing which can help differentiate us from generalized to partial seizure or focal seizure.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Okay. Triggers vary from person to person, but some common triggers include inadequate or lack of sleep, high stress levels, or inadequate meals is the one trigger. Sometimes flashing lights Children, while playing video games, they can have seizures. Fever or illness, which is the most important provoking factor that can have seizure in a known case of epilepsy. And most important cause is missing doses of anti-seizure medication in a child who is already on anti-seizure drugs.
Yeah.
So that should not be avoided.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Okay, so there are several healthy habits that can reduce the risk of seizures. I always encourage my children or my patients to have a sound sleep, as sleep deprivation is a major trigger for many children. Okay, eating regular and balanced meals is also an important thing which should be kept in mind. And yes, physical activity, it is generally safe for children with epilepsy, though it's good to avoid extreme or high risk sports without talking to your primary doctor.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Of course. So at home, it's wise to clear away the things which can cause injuries due to fall. Once the child starts having seizures, it's better to keep him in the recovery position. Recovery position is that the child should be kept in either right or left lateral position till the seizure subsides. This will help in maintaining the airway of the child. So there won't be any airway problem during this in this position.
Yeah.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, I just I would like to mention that it's a common stigma that epilepsy cannot be cured, but it's a myth. With proper guidance and proper treatment, epilepsy can be cured, and your child can live a healthy and a seizure-free life. So always keep in mind, whenever there is any symptom of a seizure, it's better to take proper guidance from a child neurologist so that you can manage your child's problem effectively. Thank you.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.